Now, information technology is considered pivotal in curbing infections of the virus through the installation of requisite infrastructure in health facilities. KTN News' Agina now reports on just how technology is transforming the provision of healthcare to ensure safety and efficiency.
It's just about midday at the Nairobi West Hospital. A spot check by KTN Business reveals an unusual exercise underway. Queues of people dot the tiny compound as they get ready to be screened before gaining access to the health facility. The hospital's medical director, Dr. Ashutosh Sood, tells me the coronavirus pandemic has literally changed how the hospital functions.
Our seating has decreased by 33% as we are practicing social distancing. Also, we have set up infectious diseases unit.
The hospital has had to invest heavily in installing thermal thermometers to ensure they are able to deal with the high number of patients at the facility, while at the same time enhance safety of frontline workers.
We've spent more than around about 4 million in this setup only.
The hospital has a disinfection tunnel that is part of the setup to ensure mass sanitization in keeping up with the World Health Organization guidelines. According to Delano Kilu, the Secretary General for the Protective and Safety Association of Kenya, he notes that a number of health facilities in the East African region are yet to embrace use of artificial intelligence in safeguarding patients.
But as hotels open, as airports open, as all these industries open, we are saying, let's open with best practice in mind so that we can keep this curve down, so that we can be able to build a stronger, better Kenya, and a Kenya that is able to deal with the challenges of the future regarding this pandemic.
Dr. Sood adds that it is no longer a gamble of whether or not to invest in safety systems, but it's fast becoming the new normal for hospitals having to install elaborate systems to contain the spread of the coronavirus.
More investment is needed in healthcare. Government support is needed in healthcare. It's very difficult to treat COVID. There are a lot of inputs which come in.
And with this, businesses are tapping into a new revenue avenue, opening up in the ICT sector.
Some hospitals have embraced that technology of the solution of the thermal temperature screening.
Some of the dealers reckon they have now had to change tack and increase shipment of thermal thermometers to meet the rising demand occasioned by the COVID-19 pandemic.
The projection is this product will be a big sale in Kenya and also in Africa, because in other countries they have embraced this technology.
Business owners, however, admit that importation of the cameras is taking close to a month or two before arrival. This for them is slowing down business. They hope the ICT Minister Joe Musheru will help streamline the ecosystem to allow for some of these products to be assembled locally.
We discussed with the President and set up an COVID-19 ICT Advisory Committee, whose role is to receive all these innovations that Kenyans are giving.
The full effect of the impact that the curfew and the cessation of movement has had to businesses in Nairobi is significant. Many businessmen are counting losses even as the coronavirus pandemic continues. Reporting for KTN News, I'm Agina.